Good morning, people. Watch Woman 65. Lisa Boyce here with a quick video this morning. I wanted to come on here and talk about the coronavirus. My friend Trish, who's a dental hygienist, was she got an email yesterday stating from the American Dental Association that they would like them to wear their mask and wash their hands as well. The mask does not protect the general public. They didn't mention a word about anything, about the people's appointments, about nothing. They will admit, the American Dental Association will admit that this is airborne. But without the special goggles, it can affect them through the eyes. This is terrible. So basically, you're just out of luck, unless you have Christ. But I wanted to give you this article today that just came off of the Zero Hedge report. Scientists now, this is unbelievable. Scientists now discover a more aggressive strain of coronavirus responsible for 70% of the current infections. So now there's another strain. Chinese scientists studying the new coronavirus have found two new primary strains of the disease, one which appears to be far more aggressive. It says here, the researchers from Peking University School of Life Sciences discover a milder S-type strain and an L-type, which is highly infectious and currently accounts for around 70% of the cases. According to the Telegraph, the researchers cautioned that their preliminary findings looked at a limited number of cases, 103, and that follow-up studies with larger data sets are needed to better understand the virus's evolution. The genetic analysis of the coronavirus found in a man who tested positive in the United States on January 21st also showed that it's possible to be infected, you ready for this, with both strains of this virus. Coronavirus, which was first detected in December of 2018 in Wuhan, China, has infected at least 94,000 people officially and killed more than 3,200 as of yesterday. And while there are now two major strains identified, scientists Trevor Bedford of NextStrain has been tracking 161. Let that number sink in for a minute. 161 strains of SARS coronavirus 2, the virus that causes coronavirus, in patients across the globe. Bedford writes in a March 2nd blog, the novel coronavirus, which is responsible for the emerging corona pandemic, mutates at an average of around 2 mutations per month. And I'm going to link the article here also. I'm going to link the article in the description box. Also, I'm going to link here where it's talking also about Jerusalem has up to 100,000 Israelis in isolation as Israel expands traveler quarantine. It says here, we have to understand we are in the midst of a global pandemic. Prime Minister Netanyahu said during a press conference, the most dangerous of these epidemics in the last 100 years. With at least 50,000 in quarantine, the health ministry on Wednesday expanded its list of restrictive orders, which will likely lead to thousands more Israelis going into home isolation. As many as 100,000 people are currently in isolation. He says here that we have to understand we are in the midst of a global epidemic. Prime Minister Netanyahu said during a press conference, the most dangerous of epidemics in the last 100 years. He said that Israel is one of the best positions in any Western country. We have had to take tough, even very rigid steps to slow the spread of the disease in Israel. Those steps include that a person returning to Israel from France, Germany, Switzerland, Spain, Austria will require to enter a 14-day quarantine. The restriction is retroactive and applies from the date that the person landed back in Israel. On Wednesday, some 19 flights were expected to land in Israel from these European countries, which will put hundreds more Israelis in quarantine. I'm going to link this article also in the description box. I just wanted to come on here this morning and give you a quick, up-to-date report on what's going on with this virus. It's not slowing down. It's not letting up. But we, as a church community, can look up because we know that our Redeemer is drawing near. And like I said yesterday, all the negative that's out there, we know what's going to happen. We fly soon. So I encourage you to just continue to look up and just keep prayed up and worded up. I'll be back on later with more. But right now, I just wanted to give you the latest on this virus and the American Dental Association from my friend Trish, who basically this sounds like the American Dental Association is trying to hide. They're just not even bringing up anything about this, which is sad. Because the healthcare workers are most vulnerable to this right now. So, but I'll be back on later. Thank you. Have a good morning.